let me ask for your individual experience with diflunisal, a drug that was taken through an international randomized trial for neuropathy and actually performed quite well. Do you ever use it for cardiomyopathy? Dr. Desai.
Yeah, so I think, one of the challenges, so diflunisal is a nonsteroidal anti-inflammatory drug that at higher doses is used for treatment of inflammatory disorders, and at lower doses seems to have efficacy, certainly in amyloid polyneuropathy, and then perhaps based on single center sort of uncontrolled trials in TTR amyloid. I think that the challenge, as with all NSAIDs in patients with heart failure, is the fluid retention that is possible, particularly in patients with more advanced renal dysfunction. And so I think that there is a niche role for diflunisal in some patients with early TTR amyloid cardiomyopathy, where it could be used safely and at low cost because it is far cheaper than the alternative. But then we tend to reserve it for patients who don't have very symptomatic heart failure, who have reasonable renal function, and who have adequate platelet counts so that they're not as at high risk for thrombocytopenia or bleeding.
Dr. Hanna, any different?
Yeah, I completely agree. The same thing with us. We actually published a paper looking at a couple dozen patients' experience with cardiomyopathy. And in that experience, we looked for worsening renal dysfunction, GI bleeding, worsening heart failure. And with careful monitoring of these patients, a couple patients had some fluid retention that we could deal with. Everybody got a PPI, so we're being very careful. And I think patients can tolerate, but I would say again, to echo Dr. Desai's comments, that if it wouldn't be more than an NYHU2 patient, we would avoid people on high dose diuretics. We'd like to see the GFR above 50. Very elderly patients on anticoagulation, we would avoid. So it's really, you're looking at the risk-benefit ratio, and we have the same experience, and we reserve it for someone whose renal function and heart failure is still in reasonably intact.